Okay, hello everybody. So we're going to start today talking about Carbidopa Levodopa. So as you know, this is a very important medication in Parkinson's. Basically, I just want to give you a little history about levodopa. I don't know you remember the movie when people having Parkinson's and throwing up all the time. So that's the levodopa producing some side effects. And the combination with carbidopa is try to avoid these side effects. But let's start talking about this. Okay, so the levodopa. So the levodopa is actually the most common medication that been using in Parkinson's. And actually for us, it's very important to indicate it really the patient have true Parkinson's versus Parkinsonism. So it's very important for me to know if you're doing well with this medication, if really the medication works, because sometimes people do not work or the dopamine doesn't work. That means probably more the Parkinsonism. So this medication has been in the markets in the 1960s, probably was not being in this world after in 1961 it came to the world. And these makers have been as old as myself. And this is actually the gold standard. This medication can produce nausea and vomiting. So the levodopa by itself has some receptors in the GI and producing these symptoms. So that's why we combine with carbidopa. So sometimes you're wondering, and somebody was asking before, how we can find the nausea with carbidopa levodopa. So the carbidopa can be given by itself in the formulation of low dosing. But again, we're going to talk about the names of these medications of Cinemed. So let's go to the next slide and we'll see what the Cinemed comes from. Exactly for that, if somebody asked about the question. So the levodopa it comes in different presentations. So when it's carbidopa levodopa, we call that a preparation Cinemed. That's the brand name, but they could be generic, just carbidopa levodopa. And again, the amount that we look for the dopamine is the levodopa. So usually come in 100s. When somebody wants to switch to Rytary, we look for the amount of levodopa. And the carbidopa, again, the first number in that combination is to avoid nausea. They come in 25, usually 25, 100, and so forth. So let's go to the next slide and we talk about a little more of this. So before going to the brand names and so forth, the most common side effect with carbidopa levodopa is nausea. So again, the levodopa by itself can produce nausea, vomiting, loss of appetite, or lightheadedness. The lightheadedness usually comes with this medication can decrease the blood pressure. So that's the main issue. So that's when we do a dopamine challenge. I usually look for the side effect with this medication, and actually, in some people can drop the blood pressure. Actually, interesting enough, levodopa is used as well in the ICU to increase the blood pressure, but at the dose we use in Parkinson's produce the opposite effect most of the time. Interesting enough, when we see some people in the dopamine challenge, the blood pressure goes in the opposite way. We call idiosyncratic reaction, meaning go the opposite way. If the blood pressure goes too low or by itself, can produce as well issues with confusion, or later in time can produce dyskinesia. So that's very important to know that levodopa is very important, but in the long run can produce motor fluctuations of the progression. So that's very important to know that levodopa can produce levodopa-induced dyskinesias. These are movements, normal movements that look like dancing. So it's very important for me in that way to know when to start this medication, not start it too soon, because long-term levodopa can produce some problems. So up to like 300 milligrams, no more than 600 milligrams is considered in quotation neuroprotective, but more than 600 milligrams is when you start having more problems. You know, the levodopa start not having the half-life will be decreasing, and they will increase in the dose, and then you start having more motor fluctuation, dyskinesias, more hypotension. So that's very important to know about the side effects from the beginning and long-term issues with this medication. Let's go for the next. Okay, talking about another side effects of this medication, we mentioned already about the nausea. And one medication to avoid nausea is called low dosing. Low dosing is the levodopa by itself to decrease one of the main side effects, which is nausea we mentioned before. Okay, so let's go for this. You see the cinemet. Cinemet, we use in Latin, the name comes from sin, without, and emet is emesis is a vomiting. So this medication, the name is actually very smart, saying that with this medication, the combination, the carbidopa, levodopa, you're supposed not to have nausea or not having vomiting. You have nausea, vomiting as one of the main side effects, mainly probably you have intolerance to the medication, or we need to adjust the dose of carbidopa. The levodopa, again, what happens, I have some receptors in the GI, so the carbidopa yes, is going to avoid to have these side effects, but it's possible, again, you are very sensitive, and if you have nausea, sometimes you can try something like tea, or you can try with a full stomach, but no proteins. We have to talk about this. So Cinemet is without vomiting, and the combination coming 10, 100 means is 10 of carbidopa, 100 of levodopa, or 25, 100, 25 carbidopa, 100 of levodopa again, or 25, 250. Usually I don't use this strong dose from the beginning, but some people need that, especially when we talk about Rytary, we see the different formulation. So usually we try 100 to 300 milligrams for beginning, but people can go up to 150 to 1,000, even more. There's usually no limit, and the limit will be the side effects, blood pressure, hallucinations, or dyskinesias. And again, the common side effects, and again, what you have to look is low blood pressure, nausea, confusion, or dyskinesias. So usually they can use as a monotherapy, but again, our philosophy, I know there is a different ways to give this medication, but I call the Cinemet or the levodopa is our money in Parkinson's. Like when you get the retirement, you have to use this medication wisely. And I try to do the right combination to be sure we're not using or increasing this medication too fast to avoid side effects. Okay, so now we have another formulation, Carbidopa Levodopa, but now the standard release. That's some of the spirit initially that we finally achieving with Rytary, which is another standard release. But the standard release, the CR, usually does not work as good because the absorption seems to be a little erratic. And but sometimes people just have the immediate release Carbidopa Levodopa. The standard release usually works very well at night. We usually start with that step. Later in time, if this really doesn't work, then we have to go something like Rytary. And again, in the previous conversation, somebody was asking me about the flora, and if somebody have like some bacteria in the duodenum, probably the absorption is not going to be very good. So some abnormal flora or absorption could be a problem with the standard release. It could be good or could be very bad. I said with the Rytary, you have issue with absorption or you have too much constipation. Can help, but it could be the opposite. So that's the way to try to make this medication adjustment, because sometimes it's very tricky, very difficult. So again, with the standard release, some people use the standard release during the day as well. It will be fine. But again, going in my experience, the standard release have very erratic absorption. Somebody was asking me before if we can chew the Carbidopa Levodopa. I said the immediate release, yes, but usually the standard release is better not to. And as well, it's not recommended to split this medication. If you want to cut the immediate release, is fine, but the standard release, all the standard release medication usually is not recommended to be crotched or be splitted. So if somebody had difficulty swallowing, or if somebody had to have a lower dose, usually the standard release is better not to use or have a lower dose. So it will be difficult to make changes in this medication with a pill coating or something like that. So with this, the same dose applies for the levodopa. Again, you can go, the maximum dose usually is more limited by side effects. More than go to 1,600, people have even a higher dose. We can talk about the pump later on, which is levodopa again. So the side effects again, blood pressure, usually with the standard release, less with an immediate release. That's the advantage of the standard release, less side effect with hypotension, probably less nausea, or depends of how the bowel is moving. They could have more nausea. The confusion and dyskinesias, again, is all implied with the amount of levodopa on the stage of Parkinson's. So again, it could be monotherapy or could be a combination. Again, in Parkinson's, we try to get the right cocktail. And this is actually the levodopa is what we call in that cocktail that I always make an example. It's like the alcohol in that cocktail. So I try to give you like the right cocktail, like a pina colada or something like that, initially make you look good. Usually the cherry in that cocktail is an MLB inhibitor like azelaic or recycling. Then later on time, you have some tremors or something, I introduce that and dopamine agonist. And then there's a time for you have the age in Parkinson's, or you need that alcohol in that cocktail, which is levodopa, I give it to you. Usually I don't start as the first treatment unless your age is already there or nothing else working, we can use this. Okay, so let's talk about Rytary. This is a very popular medication nowadays. It's very tricky though to make the adjustment, and you cannot convert one-to-one levodopa to the Rytary. Like you take in 25-100, you cannot, and there is no formulation of Rytary 100. It's 95s or 145 to 45. So it's a little tricky. So we need to get like in a small application to look in the Rytary. So Rytary is the same Carbidopa Levodopa. All it is the technology in a capsule, making the Carbidopa Levodopa very small microspheres in different, some microspheres are soft and others are harder. So they will absorb in different rates, and this is to be more steady and last for longer. So usually they have been helping a lot of people, and with the Rytary I always said it works wonderfully or it will not work at all. If you have very significant gastroparesis or there's an issue with Helicobacter pylori, one of the bad bacteria in your duodenum, usually this is not to work. But for the most part, I found this medication very good. The limitation usually is the price, but usually people get very well, especially we start a transition, we can switch it with the application. We can start slowly at night or go all together. And I find many people doing very well. And usually, again, the limitation for this I found would be the price, but that works wonderfully. But it doesn't work. I see people having issue with gastroparesis or when the bowel is moving too slow, not working for them. But the work works very well, very nicely. Okay, what's the Parcopa? So somebody was asking me before in this way, and again, I had to excuse myself for the issue with the network, and I had to thank Susan to get me and your home to this presentation. So Parcopa basically is a sublingual form of Carbidopa Levodopa. So you need something to work faster or chew it, and actually this dissolve, you can use that. But if somebody was asking me if you can, the immediate release, you can chew it. You can chew it, it's just the flavor like a chalk or something like that. But for the most part, you can do it. But again, if you chew it, that will work faster. And the Parcopa can work faster as well. I can make your blood pressure go lower. If you have a tendency to have hypotension, Parcopa probably will not be good for you, because you can have, or you can faint, or you have a hypotension. It says the same Carbidopa Levodopa, just a sublingual or disintegrating tablet. So it's a good resource I found very useful in some off time, or when somebody have or need an extra, or need is get it from off time. But again, we are very blessed to have a different presentation. So Carbidopa Levodopa, we'll talk in 1 second. So here it is. So this is the spray. So this is called INBRIJA, and this is very recent approved. The issue with this is how they have to use it. So basically, it's a powder that you place in around your mouth, and you have to inhale very slowly. Some people get very excited and inhale very strong, they start coughing. Or some people have asthma, or some people have some difficulty breathing, will be no for them. But for the most part, we use like an abridged therapy, basically bridging from one dose to another. Or you are in the middle of doing exercise, or you're playing golf, and then suddenly you feel like your dopamine is getting real low, you can use this. But have to be as well with caution if people having a problem with blood pressure going too fast, too low, or very sensitive. And again, you have to use it. And I found this medication again very good. When it works very well, we can bridge from one dose of Carbidopa Levodopa immediate release to this. And actually, this is only levodopa. It doesn't have Carbidopa, because this medication goes straight to your bloodstream. It doesn't go much to the stomach. Some people complain of nausea, but for the most part, this goes very fast. It works immediately. So you have to be very careful. It's supposed that 2 capsules of this INBRIJA that you place in this inhaler, it makes one of the immediate release. So that's, you need to know about that. Most of the time I say you need to use it, the 2 capsules fine, or no, you can use it very slowly. It's like you have a very nice cocktail. Again, you do like a very small sips of this, if you will, or inhale very small amount. Be careful with you inhale the first time. You're very excited, you inhale it too strong and you start coughing and you dislike it, and that's it. Okay, somebody was asking about the pump. Here it is. There's the Duopa, again, from Duodenum and Levodopa. That's the name of that. So this is more invasive. I don't have too many people in this, but in one point I have somebody with deep brain stimulation and the pump. And I will say that I will look for late Parkinson's, so stages like 4 or 5, or somebody had difficulty swallowing already, cannot swallow the pills, and needs constantly an infusion is something to consider. But again, if there is a lot of issue with gastroparesis of the bowel is moving too slow, it could be a problem. But for the most part, I don't have too many people in this, because nowadays we have another medications. But again, it's a very good resource. We have to have a good gastroenterologist to place the PEG tube, or place the tube in your small bowel, and then we can get the pump going. It seems to be a lot of work especially for the caregiver, but it's a little complicated in the beginning. But when it works like a charm again. But it's a little more. It's very invasive. It's a little more complicated for the provider and for the caregiver by the patient. So again, it's invasive, but it's a good resource. Now, again, going to the names of the medication, this is very smart name again, right? So it's called Estalivo, stay in levodopa. So you go from stay in levodopa, you get the name Estalivo. So you already have Carbidopa Levodopa, and I'll give you something to stay in Estalivo, because I want you to this medication to last longer. I add a COM inhibitor like entacapone. And nowadays we have another COM inhibitor. It's called Ongentys. It's only once a day. It's more expensive, but again, it's like, again, I call this the combo. Like you have your combo in McDonald's. You have your fries, you have your hamburger, and you have the Pepsi or the Coca-Cola. It's 3 medications in one. The Carbidopa to avoid the nausea. The Levodopa is the medication by itself, and the entacapone is to make this medication stay more in your system. How it does that? Go to an enzyme. It's called the COM. Inhibiting that enzyme is make the levodopa stay more in your nervous system. So it's make the medication work for longer. The main issue with this medication, and if somebody have a constipation, sometimes can produce actually loose stool, sometimes works very nicely. But we have a study, especially in females, producing more dyskinesias. Actually supposed to be the opposite, but long term, we found in a study in females here in America, especially thin females with Parkinson's, having more dyskinesia. So sometimes we find more dyskinesia long term with this medication, but for the most part, it's a perfect combination. But again, we have been getting to having a lot of medication. We can get the right combination for you. Okay, here is the Ongentys. Ongentys, you see the 3 musketeers. I call the combos. So the Carbidopa, the Levodopa, and the COM inhibitor. So Ongentys is only once a day. So it's a COM inhibitor to empower more the Levodopa, which is in the center. D'Artagnan, which is in the center. There for the 3 musketeers. Okay, so let's talk about some special consideration when you use Carbidopa, Levodopa, or Levodopa. Let's go to the next slide. So dyskinesias. So dyskinesia, you see Michael J. Fox having this movement of the head, or you see sometimes people have a dyskinesia of one leg only. So dyskinesias could be pico de dos dyskinesias or aware of dyskinesias. So this is something that we like to try to avoid from the beginning. So the longer I wait to start Carbidopa, the longer I wait of having this motor fluctuation later on life. So when somebody have dyskinesia, I have to ask, okay, when did dyskinesia happen? Like 1 hour after you take the medication is what we call peak of the dose dyskinesias. Or it's 1 hour before the next dose, wearing off dyskinesias. So this is one of the motor fluctuations, unfortunately, can happen with dopamine. So, so another side effect that you can have with dopamine is sleepiness, so also sleep. But I like to, you have to go when you have a dyskinesia, you have to let me know when that happens. And for dyskinesias, actually nowadays we have a wonderful medication with amantadine that usually we use. Is you have to remember 100 years ago we had the flu, another pandemic we suffer now. People not only having Parkinson's as well having the flu, they were given amantadine, and amantadine nowadays we're using 100 years after, not only for Parkinson but especially for dyskinesias. And we talk about that in another series. Now we have another medication, it's called Gocobric. It's just amantadine, extended release, but just to try to improve a little bit of these dyskinesias. So something we always talk about is when you need to take this medication, so post-interaction with proteins. So again, I for no means decrease your intake of proteins, it's the timing. So we know that levodopa is an amino acid. You know, amino acids are like a bricks for a wall. So the amino acids will build the proteins. So we have a lot of proteins in your stomach, then it will break down in amino acids, and not everything that you have or you no medication you have will go straight to your brain. There is something is called the brain blood barrier. So to get to the brain, these amino acids need shuttles or transporters. So if those transporters are busy with the other amino acid that you have been having in your meal, cheese, meat, bread, even some vegetable has some proteins, but you can take a little bit of decrease or low content of proteins with levodopa, because you know you can have some nausea. But the most important is that you delay 1 hour before you take the medication. Actually, you take the medication 1 hour before you have the protein, or if you decide you forget you already ate a significant amount of proteins, you have to wait 2 hours to take the medication. Otherwise, the medication will not get to the brain. I always give this example. It's like you're in New York and you go to a play and you're going to see the Phantom of the Opera. It's at 8 p.m. and I'm going to get ready from the hotel at 7:30. So I try to get a cab at an hour, I will not get it. I will miss it. So they same thing happening with the levodopa. You take it with full stomach, even you try to get, it's like the rush hour, and you don't get it at the time. You will be late. And like this time I tried to be late, but finally I had the help with Susan, I get it here. But this was the rush hour. So that's, again, you can take all the protein you want, is the timing. Again. Somebody was asking me in the way here about the nausea. So again, the nausea, again, is very common. You use levodopa by itself. Or sometimes the combination of carbidopa and levodopa is not enough. So sometimes we need to get an increase of the carbidopa by itself. It's called lodosine. Don't ask me why, but the lodosine sometimes is very expensive, meaning the carbidopa by itself, that's the brand name. You take some ginger tea or ginger ale, actually that settles your stomach. You have something to eat before, but again, we have no significant amount of protein, like a cantaloupe, like in a fruit. Even you split your lunch with, you have your salad first, which you place like a ranch dressing, but you have like olive oil or something, you place croutons or something that has a lot of protein, you'll be fine. So it's very important to settle down the stomach, but in the same time, it should not take too much protein. Otherwise, the medication will not work for you. And then you'll be diagnosed that the medication is not working. But again, many people cannot have this medication with empty stomach. So plenty of water, you can have some tea, or be sure they have something that a cracker, but some of the crackers and sodas can have some crackers have some protein, not much more the soda, but it's something that you can get different ways to make the medication to be tolerated. And usually the nausea is more in the beginning. And when I do my dopamine challenge, I look for nausea, blood pressure going down, and the tolerance. And sometimes you can say, okay, I don't tolerate, I cannot wait 1 hour, half an hour, it could be okay. It's not optimum, or you say you ate wait 2 hours is too long. And so it's sometimes cumbersome, especially if somebody's taking this medication every 2 hours or 8 times per day when we say, okay, it's better to go to Rytary. So that's what we have to look around, and everybody's different. But nausea is one of the most common side effects with this medication. And that's what the name of this medication, Cinemed, without vomiting, come from, because the combination with Carbidopa. Okay, so that's our philosophy. Again, with some neurologists or some people not very specialized in Parkinson's, they don't know much the Carbidopa Levodopa, and they just want you to get better. It's again, the Levodopa is like the money in Parkinson's. You can do better and feel very good and great in Levodopa, but worse in the beginning was fantastic. You want to feel very well, but I say, this is like this is your retirement money. If you have the Levodopa, or just get the money you have, your saving for retirement, and you say, oh no, I have a lot of money, I go to party, I want to end the cruise, I want to buy cars, and the end of 1 or 2 months you don't have any money. It's the same with the Levodopa. We start using the Levodopa too soon or too fast, then you will have nothing to you want to do for DVS, or you want to do the combination medication, will be a lot of fluctuations or complications. So there's something to think about it. That's the philosophy. I was in at Georgetown, and that's what we like to do. Many people in our philosophy, they just want to get you better right away, go very strong. It's like you press the gas and you want to have a very nice ride, but you can have an accident. You can have motor fluctuation. It's possible along the way you have something unexpected, like the blood pressure getting too low, or you can feel that lightheaded, dizzy, or you go too fast, you can have hallucinations. So it's something I had to place a little bit the brake, and everybody's different, but again, that's our philosophy. And again, in that hotel or combination of medication, I want to delay this. If somebody comes to me with the early Parkinson's, very subtle, nobody can diagnose, I start with MLB inhibitor first, and then you start having a little more of tremor, I go to dopamine agonists like Requip or Pramipexole. Later on time, you need a little, I'll give it to you. I'll try to give you the dose that you want. And then you have some complication or lasting enough, I give you a combination with a COM inhibitor. And later on in time, you have more issue with dyskinesias, is when add amantadine to the recipe. And finally, you start having hallucinations or something else, we can do nucleoside different oral medications. So this is a little complicated, but I think it makes sense to delay the use of Carbidopa Levodopa to avoid these complications later in time. Okay, so basically, we want to talk a little more about the dopamine. So basically, levodopa is the precursor of dopamine in the brain. So they want to place the dopamine, and the balance with somebody had Parkinson's, the dopamine will be lack. So it's very important to manage that medication wisely. Basically, this medication is absorbed in the blood and in the small intestine, and they have to travel through the blood-brain barrier. So I want to be sure that you understand this very important moment to get to the brain. And finally, they need a transporter, and finally it's going to convert to dopamine. And then with that, the dopamine is not only for movement, it's as well for mood. When you have too much dopamine or it's antagonized the dopamine, you can have issues with some endocrine issues. We will have to talk about that in the future as well about this. So we usually combine levodopa with carbidopa basically to avoid the side effects. And the carbidopa is going to restrict the levodopa to work in the periphery and try to work only in the brain. So as you see, the Carbidopa Levodopa, we see different formulations and different brands. We go from the immediate release, we talk from the sublingual, we have the spray, we have the gel you got in the form of the pump, the Duopa. And again, you want to stay in levodopa, we do the Estalir with combination with another medications. Or we can use the inhaler, which is the INBRIJA.